Welcome back to Bump Love. Do join the conversation on Twitter and Facebook at Bump Love UG. It's time for us to talk to an expert. She is called Dr. Florence. She's going to talk a bit more about herself. Welcome to the show, Dr. Florence.
Thank you so much, Rachel.
All right, tell us a bit about yourself.
I'm Florence Aleziyo. I am a Psychiatric Clinical Officer. I work with Butabika Hospital. I also work with Safe Places. Safe Places is a private service which offers mental health services for both children and adults. Services are offered by medical officers, psychiatrists, psychologists, therapists, and nurses. And they offer the same services that mental hospitals offer, but on private basis.
Welcome to the show. Now, we just want to hear from you. We've shared our experiences on what we think we went through after having our children. But what would you say is postpartum depression? How would you describe it in clinical terms?
Okay, before I describe what postpartum depression is, I have to tell you what depression is. Depression is a mood disorder. A mood disorder in which somebody feels low, somebody feels sad, somebody feels hopeless, helpless and worthless. And at times, such an individual may end up with suicidal ideas and even can commit suicide. So when we talk of postpartum depression, it is a depression that occurs in mothers after giving birth. It can occur within 6 periods of time, and if not treated, a mother can continue with the depression up to about 1 year. And if it is not treated, it can become a major depression the mother has to live with.
So wait, the way you've said it kind of seems like for you to say, all of us have been saying we're depressed, but none of us saw a doctor. No. So to say that you have postpartum depression, do you have to have seen a doctor, or are there cases where you have kind of mild cases of depression?
Yeah, as you have put it very right, at times mothers get mild type of depression, which mother can go through without even seeking medical advice or medical treatment, but can go through that. But if it becomes severe, really the mother needs to see a medical doctor.
At what point is it severe? Like, at what point should a mother, is it when you reach that suicidal place? At what point should...
Yeah, it becomes severe when it is interfering with your daily activities, when it is making you not to do really what you are supposed to do. You isolate yourself, you are not eating, you are not sleeping at night, you are not bothering about the child, you are not looking after the child, and you are now beginning to think of suicidal ideas. You feel you are not worth living, you are worthless. So that's the period when you really need to seek medical attention.
Shouldn't that also now be included in antenatal and postnatal care? Because most people do not know that they're sick. Because it's not like something that has, it has symptoms, but you have to know what symptoms to look out for.
Exactly.
Yeah, that's why exactly we need, if you see the health care program this time, we are really integrating mental health into the normal health system. At first, people thought when they say you are healthy, they look at your physical appearance, they think that is done. But mental health is a major component. Mental health is when you're mentally, physically, socially stable. Because you can't say that you are mentally okay when financially you have no money. Yeah? You have no money, and you will think that you are really okay, but you have other social things that need money, that need you to be visited by other people and so on, which you are not having. So it becomes a bit a problem when those other features are missed. But to be completely healthy, mental health plays the biggest component.
I think so too. And in terms, it might not be directly related to this particular topic, but why I think people need to seriously be sensitized about this. If you notice, when people go through postnatal depression, especially during the first baby, somehow your marriage and relationship is never the same. And she mentioned that when your disease is affecting your daily life, so you become irritable all the time. So slowly by slowly, your partner moves away from you, and then which even makes it even worse. So I think it's really a major thing that needs to be addressed.
I had a very good question for Dr. Florence, but you've been saying so many powerful things. My train of thought has just gone. Oh yes, there it's come. You know how they say that disease knows it doesn't know religion, it doesn't know ethnicity, it doesn't know like background color or shade or whatever. True. Are there people who are more susceptible to the postpartum depression than others, or is it like if it's come like, okay, so you're a mom, so is there something about who I am, like my strain or my fiber, that I might be more susceptible to it than someone else? Or is it one of those guessing games where, oh, you've given birth, let's wait for it? Like, are there telltale signs before?
Yeah.
Is there like a trait, like a, what do they call it?
In the family.
Yeah, is it like in a family?
Yeah.
Is there, or is it
Especially
one of those?
considering you didn't get it.
Yeah, like
so
I didn't get
thinking, it. How come it skipped her?
Is it like where you say you have statistics of 1 in every 5 women? Is it, or, you know?
Mental health issues don't occur as a single item. There must be a combination of factors that contribute to somebody to develop mental health illness, or mental health problems. One of them, the major thing that plays a role in any mental health disorder is hereditary. If you have a strong family history of mental illness or depression but in this case, there are high chances that somebody can get depression after delivery. And not only family history, if you yourself as the mother, you have ever had an episode of depression, there are chances that you can also develop depression after delivery. And if you had depression, especially during the time when you were pregnant, there are also chances that you can develop after. And from statistics, they say 1 out of 10 mothers can develop depression after delivery. There, as I've said, there are a combination of factors. One, we have talked of the hereditary. And there are other things. It may be that you have got a pregnancy when you didn't want it. It could be as a result of rape. It could be that you really didn't prepare for that pregnancy. Yeah, that one can make you develop stress, and then eventually that leads to depression. It can also be that the sex of the child you have got is not what you wanted.
You're looking for a girl, it's not a girl.
I'm laughing at you because you had 3 boys, then a girl.
And then you wanted a girl.
Funny enough, anyway, it happened, but yeah. Well,
it can be that maybe the child that you have delivered is deformed. It can affect you psychologically. And yes, you asked me that whether there are some other factors that are a risk. Someone's social status. It affects, you have no money, you're expecting this child, you're adding an additional person in this family, and you really need a lot, but the economic status can't allow that. And you are going to think of how you will manage this new coming person in the family. And at times, marital problems. There are domestic violence, quarreling, you have problems with your in-laws, you have problems with whoever is in your reach. At the end of the day, you know, as you have been enjoying what you have been saying, that somebody asked me a question that, are you pregnant? So, if you have taken it deeply and it is affecting your thinking every day, then you are liable to get postpartum depression. And also, in our daily life, there's a way we perceive things, the way you perceive what people do, what is around you. If your perception is always negative, even the pregnancy, the fetus that you are carrying, you may detach yourself from it. You feel it's not part of you, and it can also affect the way you do things.
No matter how much you breastfeed, maybe you're already detached. And then after you're done, like
True, absolutely.
that's strong. So how do you cope?
And also the pain. I think when you go through both natural labor and then you have because I was in labor for 27 hours, and then I had a C-section. And those days they try. It's important to have. It's good if you can, but they would really try to ensure that you have natural birth. So I was in labor for so long, and then I finally got cut. But the thing that really got me is this thing that had been moving in my belly for 9 months came out looking like the dad.
Really? Really?
Got you?
At my age, I had this image of what my baby was going to look like.
And it didn't have its dad's nose.
It came out.
I was
And I
you
told
carried.
the doctor,
You
I was
just
like-
carried for your husband.
Dr. Biohanga, this looks like an old OJ. That was the first thing.
Yeah.
So I'm just saying small things.
Yeah.
Like when I had my baby, my firstborn, he was Chinese. Do you know? Like he came out, even the doctors were looking at us like,
Is
so
that
that
is
you
that
don't
Brand's
have-
baby?
and so you might call him the father of this child. You know what I mean? So yeah, I get you. I get you.
you.
And so that I didn't love him because, gosh, I was crazy about him. I was that when I'm pregnant, but in my head, my baby looked like me.
In your head.
One can affect you emotionally, psychologically, and at the end of the day, it affects. And you had brought up some very important point, the way mothers are handled.
Yeah.
Before delivery, during delivery, and after delivery. And at times we land into helpers, people who help us during delivery, who are so rude, who are so rough, who throw words at you and so on. And it is even worse if you are a young mother.
Yeah.
Absolutely.
You're a young mother, you have never had any experience of any child, you are imagining what is coming out of you, what is going to happen next,
Inside me was started.
how you're going to breastfeed.
I've been through that experience.
And nobody is supporting you psychologically. You have been on your own, now you reach the delivery point, the person who is helping you is rough, and it really affects mothers to reach that point.
My question is, how do you cope or how do you help someone going through that?
Pregnant mothers need a lot of help, psychologically, emotionally, physically, financially, all that pregnant mothers need. An example, if a mother is a young mother, a 14-year-old girl, a 15-year-old girl, she will end up accumulating all this abuse in the community. And nobody comes up to support. And yet this person, one, she's underage, she's pregnant, she's going a lot of hormonal changes, she's going through a lot of physical changes, and at the end of the day, nobody is supporting her. So we even need support from the mothers, fellow mothers. Come up and talk to her. Talk to her, support her. Give her your experience of what you have ever gone through so that you support her to come out of this thing. Because she's expecting the abnormal changes she's going through. When these mothers throw these children, when they kill these children, when they do harm to these children, most of the time we get them roughly, you see how they're being handled, nobody comes to talk to them to find out
What's the problem?
nobody assesses their mental state. Then they go through a lot of challenges really.
Thank you so much, Dr. Florence.
Thank you. Very enlightening. We do appreciate your insights on postpartum depression. And if you're a mom and you are watching, I hope this has been helpful. Again, please share your stories on our social media platforms, Twitter and Facebook at BumpLoveUG. That's all we had for you today. Thank you so much for watching. Until next time, we love from Bump Love.
I stuck my tongue out.